Hi there, it's Dr. Fortna here with an update on COVID-19 disease in Hanna and Special Areas Number 2. First of all, I'll let you know that we continue to have no active cases within our area right now. That will be updated regularly on the Government of Alberta website if that changes. I know that there is increased activity in our sort of surrounding communities, including Drumheller, so always remain vigilant, especially with your travel purposes. Now, vaccines, big story. Starting next week, the mRNA vaccine, which is produced by either Moderna or Pfizer, is going to be available in communities, including the community of Hanna, through the local pharmacies, but only for people ages 65 and over. The intention is to start with people, I believe, who are 74, let them book, then 73, 72, and going down to 65. The exact details on how to book one of these mRNA vaccines for our seniors are going to be coming from PharmaSafe. We just don't have them yet. If you are over 65, only the mRNA vaccine has been approved for you. It is considered to be very effective at preventing serious illness and death, including after just one dose, although we would recommend that everybody finish their series by getting a second dose anywhere between 4 weeks and 4 months after their first dose, and you will be sent reminders to book those second doses. And we also are getting increasing evidence out of Israel, where they've done a lot of vaccinations, that unlike at the beginning where we said it only prevents symptoms, or symptomatic disease rather, there's actually good prevention of asymptomatic or no symptom disease as well, which is really reassuring. So those people who don't have symptoms and are not having disease, so that's good. Now, for those of you who are a little bit younger, between 50 and 65, you will now have access to the AstraZeneca vaccine. This vaccine is a viral vector as opposed to an mRNA vaccine, which is just a different delivery system of helping your body make the antibodies or the soldiers that fight disease. Beginning today, which is March 10th, people who are born in 1957 are able to go through 811 or the Alberta Health Services COVID-19 vaccine booking system to schedule a vaccine with a public health office. So that means for those of us in Hanna, you cannot get AstraZeneca in Hanna. You can only get this vaccine in our surrounding communities such as Drumheller. So please don't phone PharmaSafe and ask them for this. This particular vaccine is also a 2-dose series. You have to get both shots approximately 4 months apart at this time. It is less effective than the mRNA vaccine, but it is very, very good at preventing serious infection and death. So right now for that 50 to 64 group, you're not eligible yet. You haven't had your turn come up yet to get the mRNA vaccine. We anticipate that will happen sometime around the end of May, but you can, if you wish, request the AstraZeneca vaccine. Right now, this is not a both, it is an either or situation. So from my understanding, if you choose to get the AstraZeneca now and follow through with the second AstraZeneca dose in 4 months, you will not be able to get a mRNA vaccine when your vaccine slot comes up in approximately May. So you should be thinking very seriously about what you want to do, and it is a value judgment. If you're uncertain what choice is right for you, you should be contacting your family physician to talk about that and make the right choice for you. So then the question comes up, well, does it stop working as soon as I turn 65? The only thing that happened is that when the initial studies for the AstraZeneca vaccine were done, they didn't have enough participants that were over 65 to say for certain that it worked good in that group. So we're simply being extra cautious right now and saying, well, maybe we shouldn't be giving you that one. We should be giving you the one that we know works in the older group. Similarly, you've noticed some advertisements saying if you have a chronic medical condition and you are in that 50 to 64 range, you also should not be getting the AstraZeneca. Again, it's because in the original studies, there were not enough participants who had serious medical conditions to say that it's going to work well in that group. Now, do you have a serious medical condition? That's a very broad term. If you're uncertain, again, I can't give specific advice over these videos. You should talk to your family physician to say which one is right for you. What we are finding is that once these vaccines have been given, particularly in Europe, in South America, in Africa, they are actually working quite well for most of these groups, both the over 65 and the chronic medical condition, but we're going to stick with what Health Canada has recommended for now. So, next set, Johnson & Johnson vaccine. Yes, it's been approved. Yes, it is a viral vector and it is a single dose vaccine. We don't have any of it. They have enough difficulty supplying it to the United States, which is where I believe it is produced, that I don't know when it's going to come to Canada, so I would not even put that on your list of possibilities right now. Focus on the fact that we have AstraZeneca viral vector, 2-dose series, slightly less effective, but good at preventing or severe illness and death, and we have our mRNA vaccines produced by Moderna and Pfizer. Very, very good. Right now only available over 65 for the 50 to 65 range. Only right now can you access the AstraZeneca vaccine. Your turn for mRNA will come up end of May. For those people between the ages of 65 and 75, starting next week, you'll be able to start booking for yourself to get the mRNA vaccine, including here in Hanna. Now, I've spoken with PharmaSafe and they don't have their vaccine yet. They don't know exactly how they're going to be booking, so please be patient. They will make all of us aware when they know how they're going to be booking their appointments. Don't start calling them all the time because people still need them to fill prescriptions. So let's make sure they can still do their primary job. Now, there's also some confusion which has popped up around this. I think it's 211 that you phone in order to get a ride to a vaccine. I think that was probably focused around urban centers and it is not really set up for rural centers. So right now, the town of Hanna does not have a free way to drive you to your vaccine. If you are struggling to get to a vaccine appointment, you're either going to have to wait until it's available in Hanna or you're going to have to pay for your own transport to get there. So please don't call the town of Hanna expecting a free ride down to Oyen or Drumheller to get a vaccine, because right now we just can't do that. And if 211 tells you you can, unfortunately they're wrong right now. So sorry about that. Another set came up and asked me a particular question about I had a really, really bad reaction to the flu shot in the fall. Can I still get the COVID shot? Yes. So if you are very curious, what you can do is you can go on to Health Canada's website and get an exact list of all of the ingredients that are in our flu shot, as well as all of the ingredients that are in the approved COVID-19 vaccines. You can look and see if there is any overlap between them if you indeed did have a severe reaction. By severe reaction, I'm thinking about things like anaphylaxis, throat closing, needing to be resuscitated in an emergency room. All of us are going to have some sort of a reaction, a sore arm, some swollen lymph nodes, a little bit of a low-grade fever. That's a normal vaccine response. That's telling you that your body's responding. So it's a good thing. It's okay to have that. And so unless you had anaphylaxis needing emergency services, you should be very comfortable getting another vaccine. If that was the case, if you're a little bit confused about the ingredient lists, again, I'm going to send you to your family doctor. Talk to them about whether or not it's safe for you to get it. I cannot give advice to specific patients over our videos. If I am your family doctor, come and see me and I would be happy to do that. I think that's all from now. I'm expecting a ton of questions for next week, and I'm sorry that was really difficult to get through. Good luck.